most obvious disparities are in the detection, diagnosis, and prognosis of cervical cancer. It is well established that even in a place like the United States, that Black women have a poor prognosis with cervical cancer and are still being diagnosed with more advanced stages. And that disparity becomes even greater as you go, you lend your view more globally. It becomes much more of an issue of prognosis in people living in low and middle income countries compared to other countries as well. The disparities are in terms of access to screening, but also in terms of access to newer agents that have shown effectiveness in cervical cancer, including immunotherapy, as well as, again, these antibody-drug conjugates, which are really out of reach for many people in the world where cervical cancer is much more of an issue. The thing that we can do globally, though, is to really try to seek wider access and wider uptake of the HPV vaccination. It is the first vaccine that can actually prevent cervical cancer as well as other HPV-related malignancies. And I think it behooves us in our lifetime to remove those cancers associated with HPV from something we need to worry about and what our children should worry about. So vaccination can be the great equalizer here. And I think it's important that medical professionals see the HPV vaccine as a real opportunity to eradicate cervical cancer globally.